How do menstrual apps work? Have you ever used a period tracker? Seems these days everybody is doing that. You tap in a few details and suddenly it tells you when your period is coming or when you might get pregnant. But how does it actually know? Let's try and break this down. First, the app needs basic information. When the first day of your last period has started, how long it usually lasts, and how long your cycle is. The app assumes that a woman's cycle is every 28 days. From there, the app makes some predictions. Most apps use an algorithm that's programmed in to assume ovulation on day 14. Only 13% of women ovulate on day 14. The rest ovulate earlier or later. Sometimes they don't even ovulate at all that month. So the apps try as best as is humanly possible by mathematical algorithms, but they are not always right. The more you track, the better it gets. Apps can use things like body temperature when you wake up, cervical mucus. Yes, that is part of the fertility equation. How you feel, you're crampy, you're energetic, you're sleepy, you're having lower abdominal pain. Some apps will even link to wearable devices that can track your temperature, and the more expensive one might actually be able to track hormones. You're giving the app, you're actually programming the app to give a clearer picture, but know that it is still a guess. Menstrual apps are helpful, but they're not doctors and they're not oracles. They can teach you a lot about your body, but I would not advise to use them as birth control or fertility awareness method du jour. If you're trying to get pregnant or avoid it, please talk to a real human, someone who actually is trained to understand how hormones really work. Use the tools that are available to help, but ultimately, trust yourself and ask right questions when it matters.